The E-Prescribe tool allows your organization's doctors to electronically prescribe medications. The scripts are submitted directly to the client's pharmacy. As an added benefit, the prescribed medications are then synced to the Medications tab of the client record. These meds can then be formatted to display on the medical note, all of which provide an efficient means for managing meds. The E-Prescribe tool is launched from the client record. Any prescribing physician or clinician will need access to this via the desktop security in the security menu. There is a set of paperwork that must first be completed in order to register your doctors and allow them the needed access. Work with your AIM implementation manager to complete this setup. To utilize this function, the pre-configured users will go to the client's desktop, find the client to prescribe meds for, open the client record, and launch E-Prescribe. Once the E-Prescribe site has loaded, first verify the patient name and demographics. Next, verify the pharmacy. If the pharmacy is not correct or not established, or in the event that the pharmacy has changed, click the Change link. Enter the pharmacy name, city and state, and hit Find to search all potential pharmacies. Select the pharmacy, and it will be tagged to that client record. Up to 5 pharmacies can be stored per client. A couple of important things to note on the Change link. If after entering the pharmacy name and clicking Find, there are no results returned, click on the Add a New Pharmacy to the Practice List link. When clicking on this link and adding a new pharmacy, you will be required to enter the fields in red. Phone and fax are critical because E-Prescribe will fax the script to the pharmacy. You can then choose to add the pharmacy to your favorite list so that it's easier to find in future searches. Once the pharmacy is established, the system will attempt to verify the formulary. This is the client's insurance. It will populate if the client name, date of birth, and social security number are entered correctly in OnTarget Clinical. It will most likely match to any type of private insurances, but not all entitlement programs will be listed. A prompt will appear that will show you what the insurance will cover. For example, if the insurance will only cover generic medications or that savings is greater for a 90-day supply. The formulary will also allow you to request a medication history to examine when meds were prescribed by others and when they were started, stopped, etc. Be sure that you obtain a release from the client prior to accessing this information. It is typical to see up to 2 years of prior history for everything the insurance has paid for, not including cash payments. If the formulary does not populate, you can click Add to enter the client funding source and last name and search for a connection. Before prescribing any medications, it is important to ensure that any allergies are noted. This will allow the system to properly perform drug to allergy checking to ensure that any possible adverse reactions are identified. Click on the Manage Allergies link to add the client's allergies accordingly. Now that all client information has been reviewed, from demographics to the pharmacy, the formulary, and the allergy sections, you are now ready to begin prescribing medications. This is handled under the Manage Medication section. If any meds have already been prescribed, they will be listed and available for modifications, such as refilling, or stopping the med, or prescribing. If the medication has yet to be prescribed, click on the Manage Medications link and add the medication. Once the medication has been returned, you will then select the dosing. You will be prompted to fill in all of the necessary script information. Note the dose calculator, which advises on the proper dosing based on the client's weight. Continue entering the details of the script. Any directions typed in the Directions to Pharmacist field will relay any special instructions to the pharmacist, such as compounding of custom medications. Any notes written in the Directions to Patient field will print on the sticker that is placed on the bottle. The comments section appears on the medication report within the software but doesn't go to the consumer or pharmacy. These are only internal notes for reference purposes. Continue adding all meds accordingly. When you are ready to send the script to the pharmacy, click on the Prescribe link. In the medication section, it will list each of the meds you have added. You then have the option to either select Renew for existing meds or Prescribe for new meds, and further Stopping for all old meds. When clicking Prescribe, verify all information presented. The provider populates, which is representing the prescribing physician. Click Continue after all data has been confirmed. Once again, you have the opportunity to review the prescription. Also note that you can click the Add to Favorites button if you want to be able to easily retrieve this script in the future. After clicking OK, you will be asked to enter your signature password. You will then choose the path for the description, whether you just send to the pharmacy, send and print, which will allow you to print out a watermarked copy of the script. This does not allow them to fill the script, but it does give the patient a copy for their records. Print without sending will have to be used for Schedule 2 through 5 drugs. There is no way to electronically prescribe. And lastly, you can sign without sending. Note that if the intended pharmacy doesn't accept electronic orders, then E-Prescribe will send a fax. 24 hours after e-prescribing took place, the medications will populate to the client record within OnTarget Clinical. This sync occurs in the Medical section under the Medications tab. As noted in the beginning of this video, the medications listed here can optionally be formatted to the medical note if the doctor is writing documentation within the system. Should you have any more questions, please contact our support department by going to Options, Support, and Contact Support.